Who interviewed you?
What?
Who interviewed
Oh,
you?
Phyllis interviewed me. Well, I was just there and she was standing around, so we said, fine, you can interview
Is
me.
the angle of my head
It was
and
a
my
lot of
body
fun.
fine?
You look great.
Okay.
Red was a good decision too. I think we were good to go, ladies. Anytime.
Excellent. Well, Lisa Simpson, you were at the Institute after my time, and so I'm really interested to hear about your experience and how it may be similar or different from mine. So can we just start with the basics of what brought you to the Institute in the first place?
Well, I don't think I had a typical experience arriving at the Institute. I actually first heard about the Institute from Hank Foley. And he told me about what a great time he had had there. And I was in Hawaii, and I had spent 3 years as the director of maternal and child health for the state, and had become very frustrated with what I characterized as not being in the rooms with the big boys where the big decisions were being made. And I recognized I didn't really understand health policy in America. And I thought I needed to, sort of reground myself. I was trained as an epidemiologist, a pediatrician, maternal child health, but that was it. And so that was really the driving interest in coming to the Institute, was to sort of really understand what's going on in policy in America. And I also felt that I wanted some more research skills. So it was a combination of the two. But I was off cycle. It was my career has really been characterized by a lot of serendipity. And I happened to meet Phil and Hal and everybody at a point it was I think July or June, and they hadn't fully filled their slots. So
And these were fellowship slots, or what were they?
yeah, it was a postdoc fellowship. So I I was actually an ARC NERSA T32 fellow, and also a Pew Health Policy fellow. So I was sort of a joint fellow.
You brought it all together.
Well, I think Hal and Phil were very smart at sort of understanding funding streams and putting the right people in the right sort of slots. And so that's what brought me there.
And
So let me
what-
interrupt for just one second. Can you slide that microphone up as high as you can on that side thing? Yeah, beautiful.
Was that good, though? Did you hear?
Oh, everything was fine.
Okay,
Just
great.
could be a little better.
Because that was great, Lisa.
We'll just tuck that to the side somewhere. Beautiful. Sorry to interrupt.
Okay. So tell me a little bit about your fellowship training and how you think it's influenced what's happened in your career since then.
Well, first it exposed me to whole areas of sort of healthcare and health policy I really didn't understand and didn't really know. So it really broadened my understanding. At the same time, it allowed me to pursue some particular didactic interests because the fellowship combined both, the teaching and the methods and the seminars with also the ability to do classes at Berkeley. I did this fabulous course on social epidemiology that Len Simon, Tom Boyce taught. So that was a real highlight. But that training in more of the research, the methods, especially Hal's teaching, and then doing hands-on research as part of my project. I think that combined with always asking the question, what's the policy relevance? Why is this important? And those two, I think that balance was really important for me. The other aspect of it that was really great, because this, as a pediatrician, this wasn't part of my training, was the multidisciplinary nature. And so having, folks from different clinical disciplines, social scientists of every stripe, and really coming at it from different perspectives. But I remember when I went to look at the fellowship, and I don't know if Hal remembers this, but I interviewed with Phil and with Hal and Carol Kornbrot because she ended up being my main research advisor. I came prepared with interview questions for them because, I wasn't just out of training. I'd been in the workforce, and I wanted to make sure that going back to do a postdoc at this stage was really the best thing for me.
Right.
And Hal afterwards commented on, how funny it was to sort of have to answer interview questions when he thought he was interviewing me. So, but it was just a really great experience. And the other thing that I think it really taught me is the importance of networks, professional networks. Because again, prior to then, that experience, I really hadn't had real mentorship of any kind. And didn't appreciate the importance of that. And I always remember, as I think back to my experience, I really learned how to use mentors, and that Phil was sort of the career mentor, the role model, physician, policymaker. And I would have my meetings with him were always about, career options. And, this was in the early 90s. So this was before smartphones. And I always think of him as like a mental smartphone, because he could just pull up that Rolodex of names and contacts and say, absolutely. And he'd say, oh, you're interested in that? You should talk to so-and-so. Oh, you should talk to so-and-so, or read so-and-so's work. And so that was very helpful from Phil. And then with Hal, it was much more sort of the methods and the robustness and challenging me in ways in terms of the research. And then with Carol, it was like, okay, how do you actually do the research? How do you review the data? How do you actually write an article? The first article we co-authored, it was so painful for me. But, those are the right lessons.
Right. That's great. And it sounds very consistent with at least my experience there. And then, what would you say, sort of carrying forward throughout your career, how the fellowship and more broadly your time at the Institute, beyond the things you've already said, have influenced what you've done, or the way you mentor other people, or, sort of how you approach your work today?
A couple a couple important ways, starting with your last point, which was about mentorship. One of the things that the experience introduced me to was that the incredible generosity of not just the faculty at the Institute, but of the individuals they introduced me to. I remember it was through Phil's, referring me to various folks here in Washington when I was looking for my first job in D.C. And the amount of time that some of them spent with me, asking me what I wanted to do, what I was interested in. Marina Weiss was one of them. Just incredible generosity. So that I've kept that lesson, and always sort of, even if I get a cold call or a cold email from a young professional who's sort of trying to find his or her way, I always make a point of talking to them, because that helped me so much when I was getting into this. The other thing was, I think, the not willing to accept things at face value, of always asking slightly deeper questions, and not going with groupthink. And I think that's really important as you're trying to apply science to policy decisions, is making sure you're turning over every dimension and understanding both intended and unintended consequences of actions. So those are a couple lessons.
Yeah, that's good. And think a little bit about the uniqueness of the Institute, and what are the sort of the attributes of the Institute that stand out to you from the time that you were there, that seem to really make the place work for so many people, in addition to the value that it provided to the broader policy and health services research community? Sort of both of those things. I'd be interested to know.
Sure. Well, the thing that struck me early on when I arrived there was just the camaraderie. So there's a real sense of community when I was there. And since, when I've been back to visit and talk, I think that's really important, because the longer I'm in this career, the more I realize that, you spend so much of your time at work. And we're also literally a small community nationally. We all know each other. And so that sense of community and sharing experiences, I think really, for me, I started learning that at the Institute. The other thing that I think is unique is, maybe not unique, but I first experienced it there, and I think is a real strength, is that entrepreneurial spirit. That while there was this sense of community, yet each of the faculty was pursuing their own interests and applying their passion to what they wanted. Now, the downside of that is, the soft money world, you're always going after grants, but that allowing people to pursue their passion and their curiosity, I think, is a real strength of the Institute. And then the third aspect was that connection to relevance, to the state policy environment, to the federal policy environment. I mean, I had come from Hawaii, a much smaller state, from a policy perspective, much less complex than California, and I just, it was overwhelming how the tentacles from the Institute to all the various dimensions of informing policy in California. So that was really fascinating, and I think helped me realize how important it is for policymakers to have that kind of a resource that they can draw on to inform their decisions. And so that's influenced me. I mean, I've spent the rest of my career really living at that interface of research and policy, whether it's in the public sector at HHS or in the private sector and now in the nonprofit. So kind of lots of lessons there that the Institute does so well.
Right. And I think it's remarkable when you think that the Institute was the first of its kind based in a medical center in a university. Right. And the world has changed so much. And given what you're doing now, reflect on that a little bit, in terms of the infrastructure that exists today versus when the Institute was established.
It's the field, and the field of health policy research, health services research has grown dramatically in the last, certainly 50 years, but especially in the last 30, 35 years. And many more states and have institutes that I wouldn't say are just like our institute, but have developed that strength. But what I reflect on is that we're still a field that is dominated by coastal strength on the east and west coasts, and there are definitely centers throughout the country, but not enough, because those policy decisions increasingly states have always been critical, but certainly after the Affordable Care Act, even more decisions are going to be happening at the state level as part of the implementation. And so many states don't have that capacity. And so what we think about often is, how do we help our members, our health services researchers who are maybe more dispersed, connect more effectively with policymakers back in their localities, in their states. And I think that the institutes like the Phil Lee Institute, I think, have an opportunity to help sort of be mentors organizationally for emerging policy centers in other states.
Mm-hmm. Yeah, I like that characterization. Now, when somebody mentions the Institute to you, are there any sort of stories from your time there, in addition to the one of you interviewing the interviewers when you first allowed there, something that just pops out at you, a story or a moment that's really significant that either brings some humor to this history or that captures something about the Institute that you think is, sort of worth sharing with the world?
I'm glad this is being edited, because I'm going to have to think about that for a moment.
Well, think about that, and I'll ask you another question about that, and we'll come back to it. But have you kept up connections with people from those days?
Yeah.
Somehow in some ways it's hard not to, given that the community's pretty small. But sort of, what does that feel like to you?
Well, at a number of different levels. I mean, one of my best friends, Tracy Woodruff, is also a graduate of the program, and she, I was at her wedding, she was at mine. Every time I'm in San Francisco, I go and have dinner with her and her family. Importantly, she's not a health services researcher, a typical one. She's a bioengineer and has done environmental health research and the impact of environmental, particularly air quality and particulate matter, on human health. And so again, that's a good example of sort of being connected to folks outside our traditional silos. So I think there's a lot of personal connections, but then the ongoing connections with people like Hal Luft, who at Academy Health, he's obviously engaged in a number of ways, but he also has helped me at various points in my career when I was facing decision points about what to do. I remember one particular time I was back out in California, made a point of meeting Hal for lunch or breakfast, I can't remember the meal, and I was dissatisfied with my current, what was going on, and thinking about leaving my job. And he gave me some really good advice about how to redirect my interest while I kind of waited to see how the job was going to go. And that was so wise. So, that mentoring still happens, even though it sort of occurs in different ways.
Mm-hmm. Yeah.
So
I've always thought that in some ways a lot of us grew up in the Institute, and so it's almost like this familiar, all our cousins are out there, in different parts of the field.
Yeah.
So before we wrap up, is there anything else that you want to add to this that I didn't ask you about, or any sort of parting comments?
I can't. Peter, can you can you think of anything I haven't touched on?
Or maybe one other thing, you talked about the multidisciplinary environment, and you talked about the specific people you worked with who come from different disciplines, but there was also this sort of broader multidisciplinary kind of approach where they would bring the whole faculty together to, you know, review a document that somebody
Exactly.
had presented and that kind of thing. So reflect on that a little bit from your experience, and whether you ever went through, at the time they were called rip and tears, I don't know what they were called at your time, review and comment sessions with
Oh
whole
yeah,
faculty,
the
that
journal
kind of
club and
thing,
review
journal
sessions.
club and
Yeah.
sort of the you know, sort of
Research
what it
in
felt
progress.
like to be
Yeah.
part of that, and you know, sort of the value of that to you know, sort of in the formative years of somebody's work.
Right. Well, again, what impressed me about all of those opportunities to learn from colleagues and watch, you know, more senior folks in the field interact with each other, because it's also that role modeling of how do you disagree scientifically or from a policy perspective, but do it in a respectful manner that advances the conversation. So that was really my first time experiencing that. Again, my training prior to that was very, you know, unidisciplinary and not of the caliber of the intellectual sort of conversation that I saw at the Institute. So that, I think that was a good preparation for my work since then, because I think that, you know, they're really smart people in American health policy and research, and it's really, I think that training helped me just really learn to respect different perspectives, and sort of, even if I wanted to, my initial reaction was to dismiss them out of hand, to learn to pause and think about, okay, let me consider that viewpoint, let me consider that approach. And I think that's been extremely valuable in my career.
Well, thank you very much, Lisa. That was very interesting and fun.
Yeah, I won't run off with this.
You'll know about it at
So
the
what do you think, Peter?